Hey guys, Amy here, pelvic floor physio at Proactive Pelvic Health Center. And today I wanted to talk a little bit about some strategies that can be used to delay urinary urge. So in a previous post that I did on our blog, I talked about some factors that can contribute to urinary urgency. And one of the main kind of takeaways from that was the fact that our sensation or our perception of having to go is not always necessarily related to actually having a truly full bladder. And because of that, we can end up in these situations where, we're going much more frequently than our body actually needs to. So in those situations, it's definitely useful to have some strategies to be able to delay urge or suppress it. Also, I'm sure we're all familiar with a situation where, you're maybe stuck in traffic or on the subway, watching a long movie, and you for some reason you need to hold your bladder. So for a number of reasons, it's helpful to be able to delay urgency and kind of have control over that for sure. So the first step is actually to do the exact opposite of what typically our bodies want to do. We really need to resist the temptation to squeeze everything and sprint to the nearest washroom. That response can actually make urgency a lot worse. So what we want to do instead is focus on our breathing, slow down the breathing to kind of calm all the muscles in the body, but also the central nervous system. And if possible, you want to stand nice and still or sit in a supported position to allow the body to relax. And then from there, it's basically, trial and error to figure out what sorts of strategies work to distract you. So for some people, they do quite well with mental distraction. So something like, counting backwards from 100, you can make your grocery list, you can busy yourself by playing a game on your phone. Other people respond quite well to some form of physical distraction. So you can, tap your feet, you can give yourself a pinch, stretch your legs, do calf raises. There's a number of options there as well. And beyond that, simply kind of focusing on the breathing, almost going into like a mini meditation or a quick body scan is quite grounding for some people as well and works to distract. So one way or another, you just want to come up with some sort of strategy to distract your mind and direct your attention elsewhere from the urgency that you're sensing. For a lot of people, if the urge that they were feeling wasn't a true physiological need, after a couple minutes of these techniques, the urge will be resolved or at the very least suppressed enough that you can kind of, get that time to make it to the washroom. Beyond this, it's definitely helpful to see a pelvic floor physiotherapist because what we can do is assess the state of your muscles and then give you exercises that will really act to kind of help with this whole situation and give you more control.